Welcome back. Time now for my political panel. Joining me live in the studio, Liberal MP Andrew Wallace from the Labor Party, Peta Murphy. Thanks both for your time. Concerned about the vaccine, you've had it.
I have.
Sure, people, it's all okay?
I'm fine. I've got a little bit of a sore arm, as if, you know...
As if you had a vaccination.
As if I'd had a vaccination or someone's given me a little bit of a punch in the arm. But apart from that, bearing in mind that when you're in Parliament, you're always a little bit tired and grumpy. I'm totally fine. So I did it. Most people hopefully would know. I got the vaccination because I am immunocompromised, and I wanted to give assurance to people who have underlying health conditions that you can get the vaccine. Which
is a particular risk group that do have heightened concerns about getting it.
They do. So they have heightened concerns about getting it, and also heightened problems if they do get COVID, you know, harder to fight it off, and concerns about getting the vaccine and side effects. So I wanted to be part of the public health response to say, look, you can get it. And my message is also, if you've got concerns, go and talk to your GP. Go and talk to your treating specialist. Don't go Googling and searching through Facebook. I went and talked to my GP and she said, yes, get it as soon as you can. You're getting treated for cancer. Show other people you can.
Yeah, and you can get front of the queue. So what about this? We heard from St Vincent's Care Services after, look, I'm not going to call it an overdose because nothing appears to have happened, thankfully, so far to the aged care residents, but they had way too much, 4 times the Pfizer vaccine. St Vincent's saying that they actually have concerns now about whether or not there's adequate training, and they're going to raise this. This has got to worry you a bit as the federal government. This is the part you're responsible for, day 3.
Well, I think with any of these sort of rollouts, Tom, there are always going to be some teething issues. So, you know, it's not unexpected to that extent. I mean, this has happened in the UK and also in Germany, where people, particularly in aged care facilities, have received a larger dose than they should have, and there were no, greater side effects than were expected. So, look, you know, the people that will be administering the vaccines are medical professionals. You know, I'm sure that I'm hopeful that it won't happen again, but you know, these things do happen from time to time, and it's a matter of learning from them.
I guess if nothing happens adverse, what would be the number one thing there? Craig Kelly, he's gone. What are your thoughts? Good riddance?
Look, I don't want to speak ill of any of my parliamentary colleagues, no matter what side of the chamber they sit on.
Even having just spoken about the importance of vaccine confidence?
Look, I was surprised when he made his announcement in the party room yesterday. But look, nothing shocks me in this game anymore. I've been here for 5 years, and I think it's pretty safe to say that I've seen just about it all in those 5 years. You know, what the people of Australia should understand is that we as a government, led by Scott Morrison, are absolutely committed to their welfare. We're committed to getting them back into work, and we're committed to the economic welfare of this country.
So, but on Craig Kelly, 2 Prime Ministers intervened, including Scott Morrison, to save him. He was facing defeat in pre-selection, and this is his response, knowing he wouldn't get saved a 3rd time. That's disloyal, isn't it?
Well, I think it's certainly poor form. I think it's poor form for him to not have advised the Prime Minister, particularly before he made that announcement publicly. But, you know, ultimately we all have to live with our own consciences, and we all have to live with our own decisions, and Craig's made that decision. I think it's regrettable, but he will ultimately wear the consequences, whatever they may be.
Is this a time for Labor to talk about instability, or perhaps he just recognised they've still got an overall majority? Parliament's not going to crumble, I don't think. And, you know, we're trying to rebuild from a crisis, attack the policies rather than, you know, focus on this too much. What do you think?
Look, it's just incredibly disappointing and shows the poor judgment, to be honest, of the Prime Minister and the previous Prime Minister who intervened to keep Craig Kelly in Parliament. And, you know, for him to do what he did yesterday when there were a number of us out there promoting the vaccine, trying to get a really positive public health message, and he just stole Oxygen and media headlines yet again in order to promote what he says is a health response that is not a health response. It's just a disservice. And if anyone needs to know my view on it, Mike Bowers took a photograph of my face when I was sitting in front of Craig Kelly when he was giving a speech yesterday. It's on my Twitter account. As my mother says...
Can you give us the face again now? What was the face?
My face speaks volumes.
Let's just touch on...
We should play poker one day, perhaps.
Yeah,
just
you'd
joking.
win.
Just
You'd win.
Let's just focus finally on New Start, Job Seeker, whatever you want to call it, the dole. The government's laid out its plans. We still don't know what Labor's going to do.
Well, we have said clearly that $40 a day is not enough, and I've said over and over again, people who are on New Start...
a day enough?
People need to be able to not be in poverty
so
and to be able to...
So is $44 a day enough?
In the context of what else is the government doing in terms of housing, in terms of wages, and we've said clearly that we will come out with a detailed position closer to the election. I mean, at the moment, it's the government that are in power.
Why would wages matter, though, when we're talking about New Start?
Because we've got an economy that's struggling. We've got wages for people that do get jobs that are on incredibly poor wages, incredibly poor conditions. We've got 1.3 million Australians who are, you know, in danger of not being employed because of JobKeeper going. Everything is connected to each other. We've got problems with affordable housing, and my view has been clear, and so is that of many of my colleagues, is that New Start isn't high enough.
But is it high enough at 44?
We'll see what the government puts up in its legislation. And we'll see if there is a package of measures to help people to not only get into work but not to live in poverty.
What do you say to people out there struggling that they'll get an extra coffee a day?
Well, what I would say, Tom, is that it is an absolute furphy to talk about $40 a day, because that is just incorrect. The only people who would be receiving $40 a day on Job Seeker are those Australians who are actually living overseas. So if someone is on Job Seeker and they are living in Australia, they might have kids, for example. They're receiving not only Job Seeker, they're receiving...
let's simplify it.
Hang on.
Let's simplify it and say singles.
Because they're receiving Commonwealth rent... Well, singles are still receiving Commonwealth rent assistance. They are receiving energy supplement. So it's
about $7, I think,
it's factually incorrect to say that people are on $40 a day. So that we need to get that very, very clear and simple.
But what is also simple is it was increased by $4 when it was seen as very low. We're nearly out of time, but that's not going to seem a lot, is it?
Well, Tom, we are in look, it wouldn't matter. I mean, we know that there will be people that will be saying it shouldn't be increased. There'll be people who will be saying the increase was too low.